The South African National AIDS Council CEO, Dr. Thembisile Xulu, joins us for more reaction now. Dr. Xulu, thank you so much for the time. And I think let's just provide context here for our audience, if you will, because former Deputy President David Mabuza played a significant role within SANAC. Won't you just please share that with us?
Thank you so much, Arabile. So former Deputy President Mabuza was the chairperson of SANAC. And SANAC really mourns his death and would like to send severe condolences to his friends, to his family, to his colleagues, comrades, and indeed to the country which he served quite diligently. So within his SANAC capacity as the chairperson, he led various initiatives in terms of the HIV, the TB, and the STI response, key amongst them being leading the country dialogues with certain very key stakeholders like traditional leaders, interfaith leaders, and traditional health practitioners. And this came from the fact that the deputy president then actually realized the critical role that such leaders had in terms of the enormous influence that they wielded in their constituencies and within their communities. In 2021, the former deputy president led a South Africa delegation to the United Nations high-level meeting on HIV and TB, where he addressed the UN General Assembly on the country's progress towards eliminating the epidemics of HIV and TB, so that we indeed meet our goals of the National Strategic Plan, but also the goals of the National Development Plan for 2030, as well as the Sustainable Development Goals for 2030 as well. One of the key contributions was him leading the development of a common Africa position on matters of human rights, as well as matters of key and vulnerable populations, particularly the LGBTQI community. And I think if you look at the whole world, Arabile, South Africa is really lauded in terms of the stance that we have taken in minimizing discrimination for LGBTQI and key populations. So there are many, many, many more examples that I could give. Yes.
I can imagine. Just let's talk about the political and budgetary influences and hurdles that he had to fight, particularly in that time when it was not necessarily a taboo subject, but one that perhaps wasn't getting sufficient funding, sufficient response maybe as well. And he was still so keen and willing to champion the cause and fight against it.
Absolutely. I think one of the key things in making sure that HIV and TB patients were not being left behind, he was the chairperson of the SANAC Interministerial Committee for the COVID-19 vaccines. And at that time, COVID had taken all the money away from HIV, away from TB, but the deputy president ensured that there was synergy between the work of SANAC as well as the implementation of the catch-up plans in terms of HIV and TB, whilst ensuring that South Africans were vaccinated for COVID-19. And he ensured that people that were living with HIV and TB were not left behind. He also, in June 2021, actually launched the very first SANAC Private Sector Forum, which is a multi-sectoral component of the structure of SANAC, making sure that the private sector comes in an institutionalized fashion and that they are able to contribute to the TB and the HIV response. And that was part of the resource mobilization efforts in terms of making sure that all the arms of SANAC were complete, being government, civil society, and private sector.
One imagines that his leadership across all of these would have had to have been forthright, but also welcoming. How did he balance the two? What kind of leadership did he really share? And the kind of personality in that leadership did you see?
I think having worked with him as my first deputy president and the first chairperson of SANAC that I worked with, really the recognition in terms of what I mentioned earlier of the role of traditional leaders within the HIV and TB response, the role of traditional health practitioners in the HIV and TB response. When you recognize that the number of people that actually go to traditional health practitioners before they come to us as medical doctors means that we need to take them along on the journey. And it was the humility that he brought in terms of making sure that those stakeholders are respected, that they are given their place at the table, but that they are also afforded the opportunity to give their input and to guide. Because traditional leaders were then able to say, we don't understand you clinicians when you say patients are lost to follow-up. These people are in my community. I know where they are.
Yeah.
And Deputy President Mabuza led us to a place where we found each other with them, and we were able to work with them to find people in communities using structures that exist within communities led by traditional leaders. So that humility and respect for our culture and for our people was a part that I particularly enjoyed learning from him.
Interesting learnings indeed. Thank you so much, Dr. Thembisile Lequlu, for just sharing the lifetimes and everything you've learned from the man who was, of course, the second in command then for South Africa.